everyone, welcome back to my YouTube channel, Global Nurse Stories. Me again, your girl Blessing. And today I have a guest in the house named Teresa. Teresa is a friend. We are both immigrant nurses working here in the United States. We met in 2019 and we worked in the same facility from 2019 to 2021. Teresa, welcome to Global Nurse channel. Good morning.
Good morning, Blessing. I hope you are doing awesome today.
Yeah, thank you for coming. Thank you for honoring my invitation. Can you please give a brief introduction about yourself and how your nursing journey started?
Thank you so much, Blessing. I want to let you know that I don't take this for granted. I am so grateful for your invitation to this space of yours. That means a lot to me. So I'll start by saying my name is Teresa Mgore Togo. I am a mother, I am a wife, and I am also a nurse. So I did my nursing initially back home. I'm originally from Zimbabwe. I did my nurse training back in Zimbabwe, and I've been working as a nurse for the past 18 years, of which 11 of those years I did back home in Zimbabwe. So I trained as a diploma nurse, but when I came to the US, you know, the land of opportunities, I had an opportunity, and Blessing was also kind of my education advisor. We ended up doing the BSN together, and now I'm also a BSN nurse. And I'm working on taking on my master's. I know she did a master's. She did that without me. I don't know how she did that, but I'm working on my master's as well. So back to my story. I started nursing in 2006. I have worked in the operating room. I have worked in the emergency room. I have worked in a medical surgical ward back in Africa. And when I came here, I joined the medical surgical unit. I also did the cardiac unit. I did the step down. So I would say I have a vast of experience as a nurse so far.
Wow. So where are you working right now?
Currently, I am still, I'm in North Carolina, in Fayetteville, our precious hospital, Cape Fear Valley.
So what units do you work? Still
Sorry.
med-surg?
Yes, I'm still doing med-surg. I'm still doing med-surg, but I am also doing dialysis nursing. So that's still in progress. I'm still learning that. I'll be done in about a month.
So how has your experience been in the United States compared to Zimbabwe?
Girl, it's something completely different. It's a total 360-10. I know nursing is the same nursing, but the environment is completely different. The healthcare system is completely different. So it takes a lot of time, courage, and determination in order to adapt. But let me reassure everybody, nothing is impossible if you just put your mind on it. And especially if you're a Christian, you have God on your side, you can do anything and everything.
How has the journey been? You say you're a mother of three. How is settling down for the kids? How was it? And how have you incorporated yourself into United States healthcare line compared to back home?
I would say that was not an easy road. It had a lot of ups and downs, and there was a lot of learning and adjusting to do. But being a mother of three, I would say I am blessed because I came with my husband, and my first child was old. She was about 18 when you came here. So it was easy for me because I had another adult in the house, my husband, and the daughter who was 18. The only one who was a little bit of a challenge was my son, who was about 6 then. So I had to take on night shift so that I'll be at home during the day when he comes back from school. That did help me a lot. I will tell you, it was tiresome. Night shift is on its own league. It was tiresome, but because I was determined and I had to do this for my family and for myself, it did work out well. You will be tired, but still, as long as you focus and you give yourself some little breaks between, you will make it. You will definitely.
Right. So with that word that you just said, giving yourself a little break in between the job makes a whole lot of difference. So I'm going to ask that, how have you been able to take care of your mental health well-being as an immigrant nurse, having to cope with school, having to cope with full-time job and also family? How have you been able to take care of your mental health well-being?
So as an immigrant nurse, prioritizing your mental health, I would say it hasn't been easy for me, especially when you are trying to adapt to the new culture, you are trying to adapt to the new environment, you are trying to adapt to the expectations at work and even the expectations in your community. But I have learned throughout the whole process that self-care is not something that we say is selfish. Self-care is a necessity. So, in terms of balancing work and motherhood, being a wife and school, you have to intentionally carve out time for the things that you want to fill your cup. I am a Christian myself. Prayer has kept me going. I always pray. I always ask God for guidance and for direction and for help, and for sure He does. Sometimes I don't really like journaling, but sometimes I do journaling. Instead of journaling, I always read books. So there are some people who love journaling other than books. If you love journaling, you go that way. If you love reading books, you go that way. I also do exercise. I exercise by myself. I exercise with my family. I take some brief walks, some brief prayer walks, just a general walk. I go to the gym, and I spend quality time with my family. The other thing that I also did was I had a community of people, friends like you, Blessing. We will just sit down and talk. We will just to catch up with things, discuss the things that are happening around us. To know, and I found out that the problem that I'm having is not my own. That's not just me who has that problem. Everybody else has the same problem. And the more you talk to people, solutions just come up. It's just natural. It just happens flawlessly. Solutions just come up. So I also learned how to try to set boundaries between work and home. When I clock out of my workplace, physically, I disconnect from that place. Mentally, I disconnect from that place. Even today, I still do the same. My colleagues know that if I am off, they don't call me to tell me anything to do with work, because I have to be myself outside of nursing. And to be able to do that, you need to be very precise or very careful in how you do your job. You make sure that you do everything thoroughly so that they don't find any reason to call you from home. You know, in this place, if you miss something, they will definitely call you to come back. So I just make sure before I leave the hospital, I sit down. Before I even clock out, I sit down and I meditate, I contemplate. Have I done everything that I'm supposed to do? And I make sure that I do as much as possible so that they don't have a reason to follow me home, and I disconnect completely when I leave that place.
Wow, wow, wow. That's interesting. So we should give in our best when we are at work, and when you are home, you are home, you are with your family. Give your best at home also. That I'm learning from what you're saying, even myself. And self-love is not selfish. I've been able to take one or two things from what you just said. So you've said everything generally. Is there a particular stressful situation or experience that you've had that you want to share, and how you navigate the whole situation?
Oh, yes, girl. Oh, yes. There are several, but I'll just focus on one or two. The first time I came to the United States as a nurse, it was quite a challenging time because you were trying to adapt to the situation. I felt isolated at work because I didn't know anyone. And sometimes too, the clients, our patients, because they know that you are new, they kind of try to bully you, or they try to throw you under the bus for some reason. And being a new person, you have to find ways to adapt to that. So many times, I'll tell you, my first 3 or so months, many times before I left home to go to work, I would be so heavy. I felt like I did not want to go. But the only reason that kept me was that I had to prove to myself. I also had to prove to my family that I am here for them and I'm here for myself. There was no way we were going back and saying we are done with this thing, because I had done a great thing. Just relocating from my home country was a lot on its own. So there was no option there. So I had to talk to my friends about it. They advised me on what to do, especially my preceptor when I was still working with my preceptor then. She was like, you have to, girl, we have to ask for help. So I always ask for help. I always discuss with my managers anything that I felt was not or was not aligning with my beliefs, or maybe I found some issues where there was bullying with patients. And as time went on, I got used to the system. I got used to the patients. I got used to communicate. You know, there's always a communication system that's in place for any community. And sometimes because you are new, you don't know. So I found myself getting to learn that. And as time went on, I moved on. It did work out well. And one last thing on that one too. Like I said, you have to do the things that you like, or there are things that are stress relievers for yourself. For me, when I'm stressed, I cry. I have to be vulnerable here. When I'm stressed, I cry. So what I'll do sometimes when I'm leaving the house, I'm going to work, I feel like I don't want to work. I just close my door in the car in the parking lot and work. I close my door. I cry a loud cry for 3-5 good minutes. And then after that, I feel better. I go into my job. I work. I come back tomorrow. I'm good. It might be funny. It might be something.
Yeah, you just let it out. Yeah, that's the way to let it out. Wow, interesting. So you've talked about a stressful situation. So looking at the whole journey, is there any rewarding experience you want to share?
Rewarding. Oh yes. This has been a rewarding experience. Just relocating to the USA its own has been a rewarding experience. So I would encourage everybody out there who is still contemplating on thinking, should I go? Should I not go? Is the economy good? Is this and that? Will I survive? No, this is a rewarding experience. There are so many opportunities in this country. You meet so many different people from different cultures, like you, Blessing. You are like your name, you are a blessing to me. We just met and we became friends, but you have done a lot to me. You have taught me a lot. You have helped me do a lot of things. So I would encourage anyone who's contemplating to come to the USA, if you have the opportunity. This is a land of opportunity. In my country, when you wanted to do, like I said, I was a diploma nurse. When you want to do BSN, you have to drop your job, go into university for 4 years. And you know, I still have to feed my children. And I still have to go to school to pay fees. So that was something that I never thought of when I was in my country. I never dreamt of it. But here, I'm actually a BSN. I only did it in 2 years, only because I was taking
a few courses at the time.
Yes. And you know what? Scholarships were just flowing. Because of the good GPA and the good grades, scholarships were just flowing. I don't think I paid more than $1,000 US for that. So this is an opportunity. Even your children, my children right here, my daughter she's 18. She's already at work right now. She was trained. I didn't have to pay for college for her to do the course that she's doing. She was trained at the school for free. My other daughter is also working. So there are a lot of opportunities that I would never have thought back home. And I'm also able to sustain my family. I'm able to take care of my family back home. I say I have solved 99 problems. So by relocating to the USA. So anybody who's willing to come, please go ahead. We are here to support you. We are waiting for you. What are you waiting for? Come on.
Are there still nurses shortage? Is there still opportunity for people to come in?
Well, I don't think that opportunity will ever cease, because nursing shortage has always been there. You know, because elder nurses are retiring. The young nurses that are coming in, they still need the experienced nurses to train them. So we need experienced nurses to train the young nurses, and the elderly are retiring. And the population here in the US, they live for long. They live up to 100 years. So a nursing shortage is something that will never, I don't think we have a solution to that problem anytime soon. So anytime, it's open. There are open shifts everywhere. You actually have to choose. Can I go on this one? You actually have to discipline yourself, because if you don't, you will find yourself working 7 days a week.
Yeah. So you've talked a lot about self-care, self-love, and everything. So I want you to give advice to nurses right now, immigrant nurses that's in the United States right now, that they are facing burnout. Like, what advice can you give to them? You talked about all the hobbies and everything. Is there any new hobby that you picked up when you got to the United States? And is there any advice you want to give to anybody right now that is facing burnout? Because we know nursing job is not easy, is demanding physically. Thank you.
That's a great question. So, firstly, I would like to let every immigrant nurse that's facing burnout and compassion fatigue that you are not alone. That is the first thing. And your problem is nothing new. It's real and valid. So, my advice is for everybody to seek support. Number one, do not isolate yourself, because the more you isolate yourself, the more you get into depression. Seek advice. Talk to a trusted friend. Just talk in general, sitting down and talking in general. You get a lot out of it, and you relieve yourself too from just talking about the. People say a problem shared is a problem half solved. Just talking itself. You can also join support groups like your church. If you are a Christian like me, you can join support groups like nursing groups. I have seen recently, as a Zimbabwean nurses have started a group for nurses that we connect with each other here in North Carolina, or we connect nationally. I have also seen some Filipino nurses at Cape Fear Valley Hospital where I work. They support each other. So find such a group, even if you are from Nigeria like you, Blessing, and I'm from Zimbabwe. But if we relate, find a group that you can be open and vulnerable to. You can also choose to see a therapist. That is another option that is available, because from back home, we know visiting a therapist is the last option. But I'm telling you, with the situation that we are in right now, if you feel like you are overwhelmed, you're experiencing burnout, go visit a therapist. We have medical insurance. You go visit a therapist, it will be easy for you. And you can also find some spaces that you can be vulnerable, like talk to a sister if you have a sister, call a mother if you have a mother, call a brother, whoever, the next person that you relate to, that you know that they will listen to you. Call them, talk to them, and that will help a lot. That will help a lot.
Wow, thank you. Thank you so much. I really appreciate your sincerity. I appreciate how you've spoken today, because you've been able to teach. Even me, it's like I'm in a class listening to my lecture. So it's really, really interesting. And I appreciate you coming to this channel. I thank you for supporting me, because I know where we are coming from, and I've seen how far we've grown. And it's good to actually tell people out there. So I'm going to add to that. If any nurse is facing burnout, you might want to change. You might want a particular change. Nursing is so diversified in the United States. Maybe I met such nurse and you feel, oh, coming to this unit today is giving me headache, like I don't feel happy. You might want to try another specialty. You might want to go and explore and see how the other specialty is. And there's also some remote jobs that you can look into. Thank you. Thank you, Teresa. I'm going to stop here. I appreciate you coming. I've been blessed with your experience. I've learned one or two things, and I know my audience too are going to learn one or two things. Don't forget to like, don't forget to subscribe if you have not, and don't forget to share with your loved ones. You can also hit the notification button to notify you anytime we have a new guest in the house. Thank you, Teresa. My love to your family.
Thank you
Bye.
so much, Blessing. Bye.